I want you to look at these pictures. This woman dropped 4 dress sizes, and it took just 1 day. Right. Well, results, they had nothing to do with diet and exercise. Don't get too excited about her secret method. Her swift transformation was due to the removal of a 20-pound tumor. It took surgeons 3.5 hours to remove this massive growth. It not only left Kim with a smaller frame, it actually saved her life. This tumor, to put it in perspective, the size of 2 basketballs.
This may be some kind of record.
Yeah.
This is
huge.
This is huge. And of course you're gonna ask the question, how would you not know?
Yeah.
But tumors don't always grow overnight. They take time, right? And over time you can convince yourself, maybe I've just put on a little bit of weight. But this was a 3-year process that this tumor continued to grow. Luckily, she sought medical attention after things like her appetite were dissipating. And now the doctor who discovered and removed this potentially deadly tumor, Director of Surgical Oncology, Dr. Ajay Maker, joins us now. Dr. Maker, thanks for being with us.
Is this a record for you, doctor, as a surgical oncologist?
Yeah, these can be pretty rare, and this is up there. I'm not sure it was a record, but it was near the top.
And this, in fact, was a pretty rare form of cancer, but the good news is that Kim is doing well, correct?
That's right. She's doing very well, and I'm really just so pleased that she has her quality of life back.
What type of tumor was this?
This is a rare type of cancer called a sarcoma. Sarcomas themselves are less than 1% of all cancers, and there's at least 50 to 60 different subtypes of sarcoma. So the technical name of this one was a liposarcoma, and the location it was growing was in the back, or what's called retroperitoneal.
And aside from the weight gain and like a bloating feeling, any other symptoms that maybe she felt, but she said, oh, it's probably nothing, she brushed off?
Sure. You know, she was feeling constipation for many years, 5 to 10 years, gaining weight despite not eating a lot of food, an increase not only in her girth, but early satiety, meaning she would eat just a very little bit of food and immediately feel full. And then this just general feeling of fullness or bloatedness.
I think you raised an interesting point. People out there don't need to know the term retroperitoneal. Okay, but what you do need to know is that is a tumor that is essentially very deep within the abdominal cavity. Other things in that area, things like the pancreas. You're not necessarily going to just feel your belly, Dr. Maker, and just feel a massive tumor. And that's why this can be misleading, because you ask yourself, well, why wouldn't someone figure this out? And the truth is, if it's really deep within the abdominal cavity, it's maybe not as simple as just feeling a tumor. Is that fair to say, Dr. Maker?
Absolutely, you're spot on. You know, very commonly, these tumors don't even present until they get to be quite large because the symptoms can be so nondescript. And it's not unusual at all to have a case like Kim's, where she ended up having endoscopies, colonoscopies, multiple blood tests, saw many doctors for many years before she finally was referred and came to see us. And I'm really glad she did, because we were able to get the correct scans done, study the tumor itself, the science behind the tumor, presented at our multidisciplinary sarcoma board, and then make a treatment plan for her. You know, locally, her doctors, once they saw this, I think originally thought that this was not treatable due to its large size and involvement of a lot of the surrounding organs. So sometimes you just, because these are so rare, you just have to be in a place or presented in a place where they're used to seeing these things.
And of course, you always want to get a second opinion. If someone tells you they can't treat something, don't just accept that answer, because perhaps there's someone else who can.
Oh, absolutely. You know your body better than anyone, and certainly better than your doctor in some ways. And if something just doesn't feel right, you need to get it checked out. And if things aren't going the way that you think they should be, finding a second opinion is something that I always encourage my patients to do.
Well, pretty remarkable surgery. I hope you had a lot of interns to reflect.
Yeah. Thanks so much for joining us, Dr. Maker, and we're so happy that Kim is doing well, and her recovery sounds complete. I want people to pay attention to the subtle nature of Kim. Her appetite was changing. And sometimes it's as simple as your appetite is increasing or decreasing, your weight is increasing or decreasing, and there's no other explicable cause. That alone is enough of a red flag to be evaluated.